Hi everyone, happy Cinco de Mayo. Today is Tuesday, May 5th, 2020, and I'm Dr. Peterson with today's Regions EMS COVID briefing. As always, information presented today is current as of today, is changing from day to day, and may not be current tomorrow. Stay tuned to our website at regionsems.com. Click on the COVID link and you'll find a page full of resources that we compiled and time-stamped to make sure that you are getting timely and accurate information. Well, it was a busy weekend in the hospitals. I know that the Regions ED was completely full over the weekend. We are seeing a return to some normalcy. We'll see what the next couple weeks brings, as we have also seen an uptick in the number of cases and deaths. So we may be approaching our peak, but we are definitely not there yet. Numbers worldwide, we have reached the 3.6 million case mark, 3,606,038 cases confirmed. And with that, 252,151 confirmed deaths related to COVID-19. In the United States, we are at 1,152,372 confirmed cases, with 67,456 deaths linked to COVID-19. Current models are predicting that the final number may be twice that. So if that's true, we are only halfway there. In Minnesota, we have 7,234 confirmed cases. That number will probably continue to rise quickly as testing is becoming more and more available. And here in Minnesota, again, we have 428 confirmed deaths. In Wisconsin, 8,236 cases that have been confirmed, with only 340 deaths. We need to stay vigilant. Like I said, this virus is still increasing in the number of cases and deaths, and we need to protect ourselves, we need to protect others, we need to stay vigilant with our personal protective equipment, with our infection control measures, so that we do not inadvertently transmit this virus to those of us and those in our community who might be at risk. Couple reminders for today. Again, I reinforce this every video, but ECMO is still open for business. They are only treating patients at the University of Minnesota right now. So if you do call the ECMO team, you will be directed to the University of Minnesota. But please call early. You will be connected directly with the lead MD for the team, who will give you further information and help make the decision as to whether or not the patient truly is eligible for ECMO. You can call the number that you see on your screen to access the LifeLink 3 dispatch ECMO center, and they will take it from there. Asymptomatic patients are a very big concern, especially within congregate living facilities. So, as I've mentioned previously, it is very important that one of the first things you do with any patient is put a mask on them. You should already be wearing a mask, so you shouldn't need to worry about that when you roll up on scene. But every patient needs a mask. There have just been too many asymptomatic patients that are brought to the ED for reasons seemingly unrelated to COVID-19 who end up testing positive. And then we have to do the contact tracing and backtrack and notify you that a patient that you didn't suspect had actually tested positive, and evaluate your exposure risk to see if anything further needs to be done. As a reminder though, PPE works. There is data out of Seattle, as they were one of the early sites that saw a rise in cases. There was a less than 1% patient to healthcare worker transmission rate amongst their public safety workforce. What they found is that if you are wearing appropriate PPE, then an encounter with the positive patient does not equal an exposure. Even with inadequate PPE or PPE shortages, they were seeing low rates of patient to healthcare worker transmission. That doesn't mean that we can let our guard down. It just means that we can be confident in our PPE and make sure that we're wearing it appropriately and as often as we think we need to with all of our patients, and be confident that we are not going to likely inadvertently contract the COVID virus and bring it home. Along with that then, there has been some additional discussion on the antibody tests that are available. There are a large number of these tests out on the market that are authorized under the FDA's emergency use authorization, which means that they have not been validated. They are testing for two different types of antibodies that our bodies produce in response to an infection. The first is the IgM antibody, which is the acute antibody that develops within 7 to 10 days after infection or exposure. IgG antibodies are the more long-term antibodies that may confer some form of immunity, but those typically take about 21 days after infection or exposure to develop. What this means is that we can't use these antibody tests to test for acute infection. These tests are good to determine if you've been exposed to the virus at some point in the past, but they should not be used to determine whether or not you are currently infected or have been infected within the last week or two. So for this reason, they're not terribly useful for us in determining who can come off of quarantine after a high-risk exposure, or just for monitoring surveillance of who is infected and who might not be infected if we're asymptomatic. These tests are more useful for public health surveillance, so just be cautious if you decide to purchase these tests, that you understand what the role of these tests are and are not. We have some excellent information on our COVID webpage, including an opinion from one of our chief medical officers with Health Partners, as well as some links to both the CDC and the World Health Organization's positions on serology testing or antibody testing. As I mentioned, the ED was very busy this weekend. We did hear some reports of patients being held on EMS stretchers for prolonged periods of time, waiting for either a bed or staff available to take report. We are in communication with at least Regions ED on this. Please let us know if you are encountering this problem on a regular basis, and we will do what we can to look into those situations and help advocate for you. Okay, that's all I have for today. Let's go back to last week's trivia question, which was, which country claims to have eliminated the COVID-19 virus? Of the four options, we had several people that submitted guesses. First of all, Brad Roberts from Lake Johanna Fire was correct. Brian Mueller from Washington County Sheriff, you were not correct this week. You got to check your sources or something there. Jessica Johnson from Cottage Grove Fire, Sue Knutson from Amory Area Ambulance, and Gail Knutson from Marine on St. Croix Fire. We're all correct. It is New Zealand. New Zealand has done a very good job of isolating themselves, and they are only seeing single digits, very low single digits number of new cases each day, and they are confident in saying that they have eliminated the virus, and they will be one of the first countries to do so. The other options that were listed there have not declared that they have eliminated the virus, but there are some that are obviously on the downward slope of their peak based on data that's available to us. So congratulations to those of you that were correct this week. And for this week's trivia question, here it is. As of today, how many companies have given notice to the FDA that they plan to distribute testing kits under the emergency use authorization? Is it A, 59 companies, B, 75 companies, C, 120 companies, or D, 170 companies? Submit your best guess to regionsems@healthpartners.com, along with any other questions, comments, concerns that you might have. We will be happy to try our best to get back to you as quickly as we can. But otherwise, stay safe, stay healthy. Thanks for watching, and we'll see you later in the week.